Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you how to use the NuStep as a great exercise tool for aerobic health and fitness, as well as for working on your knee, bending and straightening range of motion, either before or after surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications, so you can catch all of our latest videos related to knee replacement surgery. So the NuStep machine is a pretty popular machine. You'll see it in a lot of different physical therapy clinics. And the great thing about it is it's a recumbent exercise machine, which means you're in a seated position. You have a backrest. So if you're, for whatever reason, not as comfortable being up on your feet with such as a treadmill or an elliptical machine or a bike or anything like that, this is just a little bit more comfortable, but still a way to get a nice exercise, aerobic exercise, as well as working on your range of motion and mobility. So let's go over kind of some of the setup a little bit, and then we'll show you how to use this machine effectively. So first thing, underneath your chair, there's two levers. So there's one in the front here, and there's one that looks just the same in the back. The one in the back, if you pull up on it, that's going to swivel you in so you can face the pedals, and also swivel you out so you can get on and off the machine safely and not have to kind of trip over the middle part of the machine. So I'm going to go ahead and swivel myself back into the machine here so I'm facing the pedals. And now for setup, this front lever is going to change so you can move the seat back or forward. And on the other side of the machine, kind of down in this area, it will give you a number of where your seat position is. So to do the setup, what I like to do is move the pedals so that one of the pedals is down as far away from me as it can go. And then I'm going to put my foot up, and I'm going to move the seat forward so my foot comes and is on the pedal. Now, right now my knee is pretty straight. It's almost extended or straightened as far as it possibly can. If you're doing the exercise for just general aerobic conditioning, you want to scoot the seat up so that there's a little bit of a bend in your knee, maybe about 5 or 10 degrees bend. So this is pretty good, pretty comfortable position for me here. And that would be seat position 6. Then what I'm going to do is set up the arms. So I'm going to bring my other foot up on the other pedal. And so then the arms, the same thing. You want to keep it so the pedals are kind of in their maximum position, so out all the way. And now, same thing when you're reaching out with your arm, you want your elbow to not be straight all the way. You want there to be maybe that 5 to 10 degrees bend. So my arm, the handle should be right about here. So you can just pull the arm out and kind of get to that position about here, and then there's just a little screw to tighten the arm position. And then I'll see what that is. There's a number here, and I'll match that up on the other side. And now you're in a good position to use the machine just for general aerobic conditioning and exercise. Now, just like any other aerobic activity, you want to try to build up how long you're able to do it. If you start at 10 or 15 minutes and try to work your way up to maybe 20 or 30 minutes at a time, that's really great. There's also, of course, settings on the interface here, your time, your steps per minute, and a couple other things that you can track to help see that you're progressing your aerobic exercise appropriately. You can also change the resistance or the workload on the machine. So it goes from 1, and then you can move this little lever down here, and it can increase all the way up to a resistance or a workload of 10, depending on your strength and where you are with your aerobic conditioning and exercise. So now let me talk about a little bit just to use this machine for your range of motion either before or after knee replacement. So the really good benefit that we like to use is the ability to move this seat position. So early on after knee replacement surgery, or maybe before, you might have very limited range of motion, limited ability to bend the knee. So you're going to start with the seat position back pretty far. So for example, I'm in the seat position 12 right now. And so to do the exercise, I don't have to really bend my knee quite so far. I'm kind of working up to my limit, maybe a little bit more than that, just trying to loosen up the knee. So let's say that I do this for maybe the first session or two, and I seem to be tolerating it okay, I seem to have good range of motion. So now what I can do is the next session, I'm going to move the seat up a little bit. So now I move up to position 10 or position 9, whatever that may be. And so now you can see my knee has to work, my knee has to bend a little bit further. I'm working a little bit more into that knee flexion, that knee bending range of motion. So I do this, say, for 5 minutes or so. I feel like I'm tolerating it pretty well. Maybe I'll do another 5 minutes with the seat moved up even a little bit further. There's no real set rule of how to kind of progress yourself forward, but the idea is the further you move the seat forward, the more that knee will have to bend, the more you're working on that flexion and going into that flexion range of motion of your knee. And you and your physical therapist can keep track of, what seat position you are doing this in and progressively increase that to work on increasing your flexion, increasing your bending range of motion. I like to do this exercise either kind of before, at the beginning of a session, warm everything up while also working on your range of motion, similar to like if you were to use a recumbent bike. Also, I sometimes use it at the end of the session. I'll say, hey, let's just jump on the NuStep for 5 minutes. Let's really try to crank out, working on that bending, working on that flexion range of motion, and get some benefit from it. The arms, you don't necessarily have to use the arms, but sometimes it is nice to use the arms as an assist. For example, you're trying to really bend the knee up and you can't quite get it much further. If you push and pull on the arms, maybe you can get that extra few degrees of bend as you're doing the machine. So the arms can be a little bit of an assist if you're working on this for knee flexion, knee bending range of motion. So I hope this gave some useful insights, some useful tips to use the NuStep machine both as an aerobic fitness and endurance exercise machine, but also using it as a way to work on your knee range of motion, your flexion, and also your extension and straightening either before or after knee replacement surgery. Please be sure to hit that like button. Please subscribe so you can catch all of our latest videos. And also, please be sure to leave your comments, your questions below. I do my best to respond to everyone I see. Thank you very much for watching.